Hey everyone, and welcome back for another deep dive. Today, we're going to be talking about psilocybin.
Okay.
You know it as magic mushrooms.
Yeah,
But there's a lot more to this story than psychedelic trips, you know?
absolutely.
We're diving into some cutting-edge research that's revealing its potential
Yeah.
to be a real game changer in mental health treatment.
Yeah.
So we'll be unpacking clinical trials, comparing psilocybin to its psychedelic cousins,
Okay.
like LSD,
Right.
DMT, and taking a look at the evolving landscape of psilocybin use in medicine.
I think it's really a paradigm shift.
Yeah.
Psilocybin is moving from the counterculture to the forefront of scientific exploration.
Absolutely.
And the findings are really promising.
Yeah, I was reading that psilocybin is already being used legally in medical settings
Yeah.
in a few countries, actually.
It's pretty amazing.
So before we get into all that,
Sure.
can we just start with the basics?
Yeah.
What exactly is psilocybin?
So psilocybin is a psychoactive compound, which means it affects the brain and alters consciousness.
Gotcha.
It's found in certain types of mushrooms,
Okay.
often called magic mushrooms.
Right.
But the scientific interest goes way beyond the,
Yeah.
shrooms
Right.
stereotype, for sure.
It seems like the research is really picking up steam these days.
Absolutely.
What are some of the main areas that scientists are focusing on?
So researchers are looking at its potential to treat
Okay.
a wide range of conditions, including depression, anxiety disorders, PTSD, and even addiction.
Yeah, I was reading about a 2020 study from Imperial College London
Yes,
where psilocybin actually outperformed traditional antidepressants,
that's right.
like SSRIs.
Yes.
So can you explain what's so groundbreaking about that?
Sure.
Our listener.
SSRIs, or selective serotonin reuptake inhibitors,
Right.
are the most commonly prescribed antidepressants.
Okay.
And what researchers found is that psilocybin was more effective at reducing symptoms of depression, possibly because it promotes neuroplasticity,
Okay.
allowing the brain to kind of break free from those entrenched negative thought patterns.
So it's it helps the brain rewire itself
That's a good way to put it.
in a way.
Yeah.
Yeah, exactly.
What's really interesting is that the benefits weren't just temporary. I
No.
think it was a 2021 article in the New England Journal of Medicine
Yes,
that confirmed the lasting therapeutic effects.
exactly.
Wow.
These findings offer real hope, especially for people battling treatment-resistant depression
Right.
who haven't found relief
Right.
with conventional methods.
That must be incredible for those folks.
Absolutely.
It seems like psilocybin is opening up these new possibilities
Yeah.
for treating some serious mental health challenges. I also came across research from Johns Hopkins University
Okay.
that showed psilocybin can significantly reduce anxiety and fear of death
Wow.
in patients with terminal cancer. How does that work? It appears that psilocybin can create a profound sense of connection and meaning, helping individuals confront their mortality with less fear.
So it's not just about reducing symptoms.
Right.
It's about fundamentally shifting someone's perspective on life and death.
Exactly.
That must be incredibly powerful for someone facing a terminal diagnosis.
It is. These studies are paving the way for new approaches to palliative care, helping people find peace and acceptance during a very difficult time.
It's amazing to think about the potential here.
Absolutely.
We've talked about depression, anxiety, end-of-life distress. What about addiction?
Yeah, that's another area where psilocybin is showing real promise. There have been really encouraging results from experiments with alcoholics and smokers, suggesting that psilocybin can help people break free from harmful habits by addressing the underlying psychological factors contributing to addiction.
Do we have any sense of just how effective it might be?
So some studies are showing some pretty remarkable remission rates. For example, some research on smoking addiction has reported rates as high as 80% a year after psilocybin therapy. Of course, it's important to look at these numbers in context,
Right.
but they're certainly compelling.
80%, that's huge.
It is.
This research is so exciting.
It really is.
But I'm curious about how this knowledge is being translated into real-world medical practice.
Yeah.
Is psilocybin actually being used in medical settings?
It is, and we're seeing growing acceptance of psilocybin in medical contexts all over the globe.
I'd love to hear more about that.
Yeah.
Which countries are leading the way in terms of legal medical use?
Well, Oregon was the pioneer in the United States. Back in 2019, they became the first state to legalize psilocybin for therapeutic purposes.
So someone in Oregon could actually go to a licensed facility
Yeah.
and receive psilocybin treatment right now.
Exactly. And then Canada followed in 2020. Approving psilocybin for treating depression and anxiety in patients with terminal illnesses.
It seems like things are really starting to shift.
They really are.
What other countries are adopting this approach?
Australia jumped on board in 2023, greenlighting psilocybin for treating depression.
Gotcha.
And Switzerland has also been progressive, making it available in some clinics as part of therapeutic programs.
It's incredible to see psilocybin becoming increasingly mainstream.
It is.
But with any powerful treatment, especially one with psychedelic effects,
Right.
there are bound to be concerns
Mhm.
about potential risks.
Of course.
We'll dive into those right after this. So we've been talking about the incredible potential of psilocybin, but as with any powerful tool,
Right.
it's important to proceed with caution, right?
Absolutely.
What are some of the risks
Yeah.
that we need to be aware of?
Well, you're absolutely right. Like any substance that affects the brain, psilocybin can have unpredictable effects. It's not something to be taken lightly. That's why it's crucial that psilocybin therapy is administered in a safe and controlled environment under the supervision of trained professionals.
Like, what are some of the things that those professionals would be looking out for?
Well, one of the biggest concerns is the possibility of someone having a challenging experience,
Right, yeah.
often called a bad trip.
Yeah,
The environment, the individual's mindset,
right.
and the presence of a supportive guide or facilitator can make all the difference.
So it's not just about taking the compound,
Right.
it's about creating the right conditions for
Exactly.
a safe and meaningful experience.
We call this set and setting,
Right.
and it's a critical part of responsible psilocybin therapy.
That makes a lot of sense.
Yeah.
Now, beyond the potential for a difficult experience, are there any other risks involved?
Well, it's important to remember that psilocybin can interact with certain medications.
Okay.
So careful screening is essential. And for individuals with a history of certain mental health conditions, like psychosis, psilocybin therapy might not be appropriate.
So it sounds like there needs to be a thorough assessment process
Yes.
to make sure that this is a suitable treatment option.
Absolutely.
You mentioned earlier that several countries
Those
have
such a-
legalized psilocybin for medical use.
That's right.
So I imagine that raises a lot of questions about how to regulate it properly.
Absolutely. One of the biggest challenges is figuring out how to integrate
Yeah.
psilocybin therapy into healthcare systems in a safe and equitable way. We need to establish clear guidelines and protocols
Okay.
for training facilitators, licensing clinics, and ensuring access for those who could benefit.
Access is a big issue with a lot of new treatments. How do we make sure that psilocybin therapy
Yeah.
doesn't just become something that's only available to the wealthy?
That's a crucial point. We need to advocate for policies that prioritize affordability and accessibility so that psilocybin therapy can reach those who need it most, regardless of their socioeconomic background.
There's a lot to figure out, but it's exciting to see these conversations happening on a global level.
Absolutely.
It feels like we're on the cusp of a real transformation
Yeah,
in how we approach mental health.
for sure. Yeah.
So we've talked about the potential risks of psilocybin therapy.
Right.
What about the broader societal implications?
Yeah.
What are some of the ethical considerations that we need to keep in mind?
Well, we have to be mindful of the potential for misuse. Even though psilocybin isn't considered to be physically addictive, there's always the risk that it could be abused. So it's important to have responsible regulations in place to prevent that.
That's a valid concern. You know, it's important to learn from past mistakes
Absolutely.
with other substances that have the potential for misuse. What else should we be thinking about for an ethical standpoint?
It's crucial to acknowledge and respect the long history of psilocybin use in indigenous cultures. We need to approach its integration into Western medicine with humility, ensuring that indigenous voices are heard
Right.
and that their traditional knowledge is honored and protected.
So it sounds like there's a delicate balance to strike between scientific advancement and cultural sensitivity.
Exactly.
Yep.
We need to proceed in a way that respects both the scientific evidence and the cultural heritage associated with psilocybin.
So it's clear that the integration of psilocybin
Yeah.
into mainstream society is a complex process, potential benefits and risks. What does the future hold for psilocybin? Where do we go from here?
The research is rapidly advancing, and we're seeing more and more clinical trials being conducted all over the world. We're gaining a deeper understanding of how psilocybin works in the brain, particularly its effects on serotonin receptors.
So for our listener who might not be familiar,
Sure.
could you explain what serotonin receptors are And why they're so important in the context of psilocybin's effects.
Certainly, serotonin is a neurotransmitter that plays a crucial role in regulating mood, emotions, and perception. Psilocybin binds to serotonin receptors in the brain, which is thought to be a key mechanism behind its psychedelic effects.
So it's like psilocybin is essentially mimicking serotonin in the brain?
That's a simplified way to think about it,
Okay.
but essentially, yes. By activating these serotonin receptors,
Right.
psilocybin triggers a cascade of changes in brain activity, altering perception, emotions, and thought processes.
And that's what leads to the therapeutic effects we've been discussing.
That's what researchers are trying to understand. It seems that by temporarily disrupting habitual pattern of
Right.
thinking and feeling, right? Psilocybin can create a window of opportunity for new insights, emotional breakthroughs, and positive changes in behavior.
It's like shaking up the snow globe
Yeah.
and letting things settle in a new way.
That's a great analogy.
I know we've been focusing mainly on depression, anxiety, and addiction, but are there other conditions that researchers are exploring psilocybin
Yes.
as a potential treatment for?
There's growing interest in investigating its use for a wide range of conditions, including obsessive-compulsive disorder,
Wow,
eating disorders, chronic pain, and even Alzheimer's disease.
those are some pretty diverse areas of medicine.
They are.
It's amazing to think about the possibilities.
It's an incredibly exciting time to be following this field.
Yeah.
We're only just beginning to scratch the surface
Right.
of what psilocybin might be capable of.
With all this potential comes a lot of responsibility.
Absolutely.
It seems like we're navigating uncharted territory here, and it's important to proceed with both enthusiasm and a healthy dose of caution.
I agree.
We'll be back in a moment to wrap up our deep dive into the world of psilocybin.
Okay, so we're back. And I don't know about you, but my mind is like buzzing a little bit
Yeah.
after all that.
It's a lot to take in.
Yeah.
For sure.
We've gone from like the molecular level tonin receptors
Yeah.
to the global implications of like legalizing a psychedelic compound.
It's been a journey for sure.
Yeah.
We've seen how psilocybin is shifting from
Yeah.
the margins of counterculture
Right.
to the mainstream of like medical research.
Right.
And the potential benefits are truly remarkable.
Yeah, we've covered so much ground. The promising clinical trials for things like depression and addiction.
Right.
The careful consideration of the risk, the importance of set and setting.
Yeah.
And then like the complex ethical considerations, integrating psilocybin into our healthcare system. Yeah. It's a lot to take in, but I think one of the key takeaways.
Here is the sheer transformative power of psilocybin.
Absolutely.
Yeah.
I think you're right. It's not just about masking symptoms.
Right.
It's about fundamentally changing the way people perceive themselves,
Yeah.
the world around them, and even their relationship with mortality.
I think that's what makes this topic so fascinating.
Yeah.
And honestly, a little mind-blowing. It
Yeah.
seems to have this ability to like help people break free
Yeah.
from these like deeply ingrained patterns
Right.
of thought and behavior, which could be incredibly liberating for those struggling with mental health challenges.
Yeah, it's like hitting a reset button on the brain, allowing for new perspectives and possibilities to
Yeah.
emerge.
Yeah, and what's even more remarkable is that these changes seem to be lasting, suggesting that this could potentially lead to like profound and enduring healing.
I think so.
It's almost as if psilocybin gives people this glimpse into like a different way of being. And that experience can have like a ripple effect
Exactly.
throughout their lives. But of course, we can't forget about the importance of responsible use and regulation.
Potential benefits of psilocybin are undeniable, but we need to proceed with caution and ensure that it's used safely and ethically.
Yeah.
That means establishing clear guidelines, training qualified facilitator, and protecting vulnerable populations.
And as we discussed earlier, we need to be mindful
Absolutely.
of the potential for misuse and learn from past mistakes
Yeah.
with other substances. Right. So it's crucial to have like a balanced approach
It is.
that acknowledges both the risks and the rewards.
I couldn't agree more. This is a powerful tool that needs to be handled with care and respect.
Why?
But I'm optimistic that with like thoughtful research and responsible integration, psilocybin has the potential to revolutionize the way we approach mental health treatment.
Absolutely. So what does this all mean for you, our listener?
Yeah.
What should you take away from this deep dive into the world of psilocybin?
I think the most important thing is to stay informed and engaged.
Yeah.
This is a rapidly evolving field, and there's so much more to learn and discover. So keep exploring, keep asking questions, and be open to the possibilities.
I second that we've only scratched the surface today. But I hope this deep dive has sparked your curiosity
Yeah,
and given you some food for thought.
for sure.
Um, who knows what the future holds for psilocybin? But one thing is for sure, it's an area of research that's worth paying attention to. Thanks for joining us, and until next time, keep exploring the frontiers of knowledge with an open mind.